Okay. Good morning, good afternoon, and good evening to everyone who's watching. So, for today, we are going to talk about the nature and symptoms of pain. But before that, let me introduce to you yung table of contents. So, una, we have what is pain and theories of pain. Both will be discussed by me, to be followed by Miss Apilit's discussion on biopsychosocial aspects of pain, and then assessing people's pain and pain in children for Miss Narap. Sa una, define muna natin kung ano ba ang pain. So sabi dito, pain is the sensory and emotional experience of discomfort which is usually associated with actual or threatened tissue damage or irritation. So basically, pain is a distressing feeling caused by tissue damage. Saan ba tayo pwedeng makakuha ng tissue damage? A lot of ways. We have injuries, falls, fractures, bruises, bacterial infections, and even accidents, and marami pang iba. Now, virtually all people experience pain and at all ages, which is tama naman. Kasi, pagkapanganak mo pa lang, there's pain already. The moment your mother gave birth to you, doon pa lang, naramdaman mo na o naranasan mo na kung ano bang pain. Sa infancy, we have teething. Ang life mo as a child, merong pain from all of the bruises and all of the injuries na nakuha mo kalalaro mo. Even ngayon, sa adulthood, may it be physical or emotional, there is always pain. Another, some pain becomes chronic. I will discuss more about chronic pain later, pero when we say that a pain becomes chronic, ibig sabihin nun, it lasts for a long time. Usually for more than 3 months. Pero hindi naman ibig sabihin nun na buong time na yun or buong month na yun is meron palaging process ng pain. Ano lang siya, pabalik-balik. Examples are mga arthritis, stroke, diabetes, mga migraines, mga ganyan. Now, people's experience with pain is important for several reasons. Hindi ko na babasahin yung nasa PPT, pero unang-una, kung bakit siya importante kasi most common reason why people visit a doctor is because of pain. 80% ng mga tao na nagpupunta sa doktor, ang rason nila, pain. Pangalawa, when a pain is severe, it can take over the person's life. Kasi, for example, syempre, if someone is in pain or ill, let's say ganyan, it will be hard for that person to work, to do the daily task, the basic task na usually ginagawa naman niya. Another is, once you are ill, it will be hard then for you to maintain your personal relationships with other people kasi there's frustration, may sadness, idagdag pa natin yung mood swings. Lahat ng feelings na yun, lahat ng emotions na yun, possible na makapagpa-strain ng personal relationships. And let's also not forget that when you are ill, you have limitations. So, pati yung pag-spend mo ng time with your family, pati yung pakikipag-participate mo with social events, ganyan, malilimit din yon. And that may lead to distance and even isolation. And once na nag-lead na siya sa isolation, possible na maapektuhan yung tao mentally. Kasi mafe-feel niya na alone siya. So, I think it's really parang we need to give our longest patience to our loved ones na merong mga sakit, especially if deserved naman. Kasi I feel like yung battle nila mentally and emotionally is way more harder kumpara dun sa illness talaga. Dito naman, sa number 3, sinasabi dito that pain has an effect on the society. Let's say, meron kang pain and malala siya. Tapos, you need medication, you need treatments, ganyan. Pero, you do not have the means to pay for your own healthcare costs. Shouldering ngayon ng family mo yun. Affected ngayon ng family mo. Kasi, sila iisip at gagawa ng paraan para masustain yung pangangailangan mo. Now, what if pati family mo hindi na rin kayang i-shoulder yung bills mo? Ano ang possible na solution? We have financial support from the government and also insurance. Yeah, pwede. Now, what if ka pa, business owner ka pa, tapos bigla kang nagkasakit? Syempre, it will be hard for you to operate your own business. Pero hindi lang ikaw, hindi lang family mo, na binubuhay mo, in case, and hindi lang yung business mo yung affected. Affected din mismo yung consumers mo, the economy itself. So you see, pain does not only affect an individual, but the society as a whole. And then, next we have the qualities and dimensions of pain. Okay, we might describe some pains as sharp and others as dull. We can consider a pain as sharp if it has parang a pricking and stabbing feeling. Parang muscle tweaks, chest pains, and even paper cuts. Pag dull naman, it is a pain na parang throbbing and aching type of pain kagaya ng mga muscle sore, joint pains, mga ganyan. Pero we also have to remember that the type of pain we feel depends on what kind of damage and also yung location ng damage or ng pain. For example, if yung damage is located siya deep inside our body, usually makakonsider natin siya as dull pain. Pero pag yung pain is located siya sa skin, usually makakonsider natin siya as sharp pain. Next, we have organic versus psychogenic pain. The pain under organic pain, the pain we experience that is clearly linked to tissue pressure or tissue damage. Alam niyo na yung tissue damage. Pag tissue pressure naman, the simpler example for this is when you have a toothache. Yeah. When you have cavity, that will create pressure on the nerves na nasa loob mismo ng tooth na yon. And possible pa yung lumala if mag-chew ka, umuya ka kasi maladagdagan yung pressure. So, mas maladagdagan yung sakit. And also, pag organic pain, meron siyang organic basis. Merong evidence ng pain na makikita natin or ng mga doctors. Now, paano pag ganito? This is an example from the book. So, there's this man, and he is schizophrenic. Tapos, he believes that he was being shot by a weapon, by a gun, let's say. Pero yung totoo, wala namang pamamaril. Walang baril, walang bleeding, walang damage, wala lahat. Pero he feels the pain as if he was really being shot. As if he was really being hurt. Dito ngayon pumapasok yung tinatawag nating psychogenic pain. It comes from a pain that walang physical injuries or physical damage that a doctor can find. And it is all linked to the mind. It is because of psychological factors. Now, dati mga researchers, mga experts, sinasabi nila that organic and psychogenic pain is completely separated from each other. Kasi ang psychogenic daw, wala naman siyang organic basis. Like parang, the person is only imagining his pain. Pero, dumating ngayon si Donald Bacall. Siya ngayon yung nagsabi that there is a misconception about pain. Siya yung nagpaintindi sa mga experts and mga researchers that both types of pain hurt. And that psychogenic pain hurts as much as a pain that comes from an illness or an injury. So ngayon, naintindihan na ng mga experts that almost all type of pain is both a mixture of mental and physical factor. And so parang instead of seeing them as two separate things, we now see them as a part of a spectrum. Next, we have pain disorder. Ano na to? Self-explanatory. So, pain disorder, when people experience severe long-term pain with no detectable physical basis, psychiatrists diagnose the condition as a pain disorder and often assume the origin is mainly psychogenic. It is also classified within somatoform disorder. When we say somatoform disorder naman, it is a mental condition wherein a person experiences physical symptoms that cannot be fully identified or explained by medical or physical causes. Like, pwede kang makaramdam ng pain, pwede kang makaramdam ng fatigue, ng any physical issues, pero pagdating na sa medical examination, wala namang makikitang reasons, physical reasons or physical causes. And again, malaki ang influence ng stress, ng anxiety, ng traumatic experiences sa past para maranasan to ng isang tao. Next, we have acute pain versus chronic pain. So, acute pain refers to the discomfort people experience with temporary painful condition that lasts less than a few months. Yeah, so acute pain, it's a sudden type of pain. Urgent siya, and usually nag-result siya from an illness, injury, and even surgery. Also, yung mga patient or mga tao mayroong acute pain, they often have high levels of anxiety. Kasi unang-una, the pain itself, it's uncomfortable. So, dealing with the discomfort can really make people feel anxious. Another is yung pagiging sudden niya nga. Pag bigla kasi may pain na dumating, syempre, you will worry talaga kung ano ba yung cause niya, kung gaano ba siya ka-serious. So, yung fear of the unknown, it can increase anxiety and stress. Tapos, another yung interference na nagagawa niya sa buhay ng isang tao. Yung biglang, hindi ka na makapag-work, hindi ka na makalabas with your friends, yung bigla kang merong disruptions and limitations. Lahat yun pwedeng maka-increase ng anxiety. level. Pero yung levels of anxiety nila, nagdi-decrease din yun once na nakikita na nila or nararamdaman na nila na yung cause ng pain nila is nawawala na or gumagaling. Dito naman sa chronic pain, nabanggit ko na sa inyo kanina, it is when a painful condition lasts longer than its expected course or for more than a few months. Yung mga taong mayroong chronic pain, they also have high levels of anxiety. However, it don't decrease kasi the pain is persistent. Matagal, pabalik-balik siya. So they tend to feel hopeless and helpless kasi they don't see that the medications or the treatments are actually working. The effects of chronic pain also depend on whether the underlying condition is benign or malignant and worsening, and whether the discomfort exists continuously or occurs in frequent and intense episodes. When we say benign, meron ng certain level of discomfort, uncomfortable man yung pain, pero it's not, life-threatening. Pero pag malignant, yun na yung harmful na siya, kagaya ng cancer. We also have 3 types of chronic pain. We have chronic recurrent, chronic intractable benign, and chronic progressive pain. Dito sa chronic recurrent, hindi naman siya linked with any harmful causes, pero it has a strong pain episodes na pwedeng mangyari ng paulit-ulit. Pero hindi naman tuloy-tuloy. Like, for example, ngayong araw, meron kang malalang migraine. And then a few days after that, wala. You're completely fine. Tapos, tsaka siya babalik. Ganun siya. Pag chronic intractable benign naman, the pain is usually present, pero it does not have the same intensity. Like, parang it changes from day to day. Para siyang, back pain. Yeah. Back pain na hindi nawawala, pero hindi lumalala. Pag chronic progressive naman, ito na yung link na siya with serious illness with harmful causes, like cancer again. And also dito sa chronic progressive, the pain gets worse kasi the condition also worsens. Next, we have the physiology of pain perception. Hindi ko na rin yun babasahin, pero dito sa physiology of pain perception, in-explain na dito kung paano ba natin napaperceive yung pain. So, una, for example, meron kang, damage dito, may bruise ka dito. So, may pain. It will now trigger a quick reaction to your body. Ang gagawin ngayon ng body mo is mag-release yan ng chemicals like serotonin, histamine, and bradykinin. Ang gagawin ngayon, 3 chemicals na yun is unang-una, it will help you fight infection kasi it promotes an activity to our immune system that protects us against germs. Pangalawa, it will cause inflammation. Yung wounded part kasi natin, yung injured area, kailangan niya mag-swell kasi it is a part of the healing process and siya yung magkakause ng swelling. Third? Yeah, it will activate nerve endings around doon sa injured area, which signals that something is wrong in your body. Yung signal na yun ngayon, magta-travel siya papunta sa special nerves na tinatawag natin nociceptor, which is responsible for sensing pain. And then, yung gagawin ngayon ng nociceptor, i-rely niyo yung message kay spinal cord, and then the spinal cord will carry the pain signal to the brain, and that's when we are going to perceive or recognize the presence of the pain. Next, we also have 2 types of fibers. We have A delta and C fibers. Hindi ko na rin yan babasahin. Pero ang A delta fiber, it is considered as the fast messenger of our body kasi it transmits pain signal quickly, and that is because of the presence of a myelin. Ang myelin kasi, it acts as parang electrical wire na tumutulong sa nerve impulses natin to travel along the fiber, and very important yun since ang A delta kasi responsible siya sa mga sharp types of pain. So if the pain signal is quick to be transmitted, we are also quick to react or even avoid further injury. Like kunwari, if nakahawak ka ng mainit na stove, ganyan. So dahil sharp siya, nasa A delta, mabilis yung travel ng pain signal. So mabilis natin na matatanggal yung kamay natin doon sa stove para hindi na tayo lalong papasok. Pag C fiber naman, kumpara sa A delta, it transmits pain signal in a slow pace. And that is because of the absence of the myelin, and also responsible siya for dull pains. So since wala siyang myelin, it does not require immediate action. So it goes deeper to the parts of our brain that affects our mood and even emotions. So kunwari, meron kang body ache na iniinda. So, since wala ka naman agad magagawa to remove that pain, possible na all day feeling mo mahina ka, feeling mo pagod ka kasi nga meron kang pain na dinadala na hindi mo agad masolusyonan. Ganun siya. Okay, acute pain in burn patients. Alam nyo na to eh. First degree, second degree, and third degree. Malamang ang first degree natin, siya yung pinaka less severe. Dito magkakaroon ng pamumula, pero hindi naman dadating sa point na magpapaltos siya. Kasi ang affected lang naman is the outer layer of our skin or yung epidermis natin. So, since hindi naman siya talaga severe, usually it heals naman without any complication. Pag second degree, it can be very painful na kasi imbes na epidermis lang yung affected na din yung layer underneath that or yung dermis. And usually, nag-result siya from scalding or burning, syempre. Pag third degree, it is the most severe. Dito, madadamage na yung both layers ng skin natin and then pwede pa siyang pwede niya pang madamage yung layer ng bones, ng muscles, ng organs, mga ganyan. Pero even though third degree is the most severe, it is possible for us to not feel the pain at first kasi sa sobrang lala ng pagkakasunog, pati yung nerve endings natin nadadamay and that will make it hard for us to feel the pain initially. Kasi diba ang nerve endings connected siya sa mga tissues like sa skin, sa organs, sa bones, sa muscles, and responsible din siya for sensing pain. Next, we have hospital treatment for patients with severe burns progresses through 3 phases. We have emergency phase, acute phase, and rehabilitation phase. So, dito sa emergency phase, chinecheck lang kung gaano kalala yung burn, and they are also focused on keeping the body stable. Also, yung mga doctors, they try to fight any types of infections, and then they also make sure that the body has enough fluids or salts, or hindi natawag na nating electrolytes. Electrolytes kasi, it can help us to move our muscles, and also it controls the water in our bodies. Once kasi kunwari nag-sweat tayo or nag-lose tayo ng fluid, like after a burn, mag-lose din tayo ng electrolytes. And that will make us feel weak and sick. So, we really have to keep it balanced sa ating body. Pag acute phase naman, it lasts until the burn area is covered na with new skin. Usually, mag-last siya for a few days or months, depende kung gaano kalala yung sunog. And then, dito din sa phase na to, constant na yung pain kasi if third degree, dito na mag-start mag-heal yung nerve endings natin. And sabi, it can really be painful. And under acute phase, we also have tankings. So, dito sa tankings, the patient is placed in a tub na mayroong water para tanggalin yung mga old bandages, mga old debris, ganyan. Kailangan silang ilagay sa tub may water kasi una-una yung water, it helps soothe the pain. It gives relief doon sa patients habang ina-undergo yung procedure kasi isa sa pinakamasakit na procedure is tankings and debridement. And then also, it softens the skin. So, hindi ganun mahihirapan yung mga medical staff, yung mga doctor, para tanggalin nga yung mga old bandages. Next, we have debridement. So, dito, mga fresh medications, mga new dressings na-apply. So, panibagong mga ointments, panibagong mga bandages. Okay. Last, we have rehabilitation phase. Starts when the patient is discharged from the hospital and continues until the scar tissue has fully healed. During this time, the pain usually decreases, but the patient may experience itching in the healed areas, which can be uncomfortable and shouldn't be scratched. Hindi siya pwedeng ma-scratch kasi pag gumagaling kasi yung mga sugat natin, nangangati talaga siya. Pero it is not parang advisable na kamutin kasi possible na mag-worsen yung condition and pwedeng mayroong infection na mapunta doon sa nag-heal na scar natin galing sa burn. Also, ano ba to? Okay. In the hospital kasi, ang ginagamit talaga to manage acute pain, kagaya ng patients with burn, yung mga areas sa bodies nila, ang ginagamit is analgesic medication. Analgesic medication, it's drugs that are designed to relieve pain, mga painkillers, ganyan. Pero according sa book, psychological technique can also help, kagaya ng ginawa ni Robert Wernick. So, yung ginawa niya, he worked with adult burn patients to mentally prepare them for painful procedures kagaya nga ng tankings and ng debridement. And yung procedure na ginawa niya, nagkaroon ng sense of control yung mga patients over their pain, and also parang natutunan nila kung paano i-manage yung discomfort nila in a better way. And so even if hindi naman sila sinabihan na mag-take ng less medication, they ended up taking fewer drugs kumpara sa mga pasyente na naka-receive lang ng standard hospital care, and nag-work din yon sa mga children. Sa book kasi walang parang detailed explanation kung paano niya ba ginawa yung procedure, pero I looked it up sa Google and I found out that he educated them on what to expect during the procedure para at least mabawasan yung fear nila, para ma-feel nila na prepared sila for what's coming for them. And he also taught them how to do proper deep breathing, yung mga relaxation techniques, and he taught them to change their ideas about pain using positive self-talk, o yung mga phrases, yung mga words na pwede nating sabihin or isipin to make us feel better. Next, we have referred pain. Hindi ko na rin babasahin, pero sa referred pain, it happens because the brain gets confused on where the pain signal is actually coming from. Like, pwede kasing ma-misinterpret ng brain natin na yung signal nanggagaling sa skin, even if sa organ naman talaga, if the skin and the organ shares the same nerve pathway along the spinal cord. Like, for example, sa heart attack. Di ba kasi pag heart attack, pwede tayong makaramdam ng pain sa left arm or left shoulder natin, even if yung pain is nasa heart naman talaga. Yung problem is nasa heart naman talaga. That is because both the arm and the heart, they send signal under the same nerve pathway, and the brain refers kasi to a more familiar source, which is usually yung skin. Next, we have pain with no detectable current cause. Some pains people experiences are curious because medical exams find no current cause for them. For instance, no nauseous stimuli is present. These pains are usually classified as neuropathic pain. Neuropathic pain results from current or past disease or damage in peripheral nerves. The three common neuropathic pain syndromes are neuralgia, castalgia, and phantom limb pain. Dito sa neuralgia, it is an intense type of pain na sudden, and ma-feel natin siya along the nerve path. And one common trigger of this syndrome is an infection that we call shingles. Yun kasi yung it can damage our nerve endings, mga nerves natin, and it can make them overly sensitive. And another type of neuralgia is trigeminal neuralgia. Yun naman, it damages a major nerve in our faces. And possible tayong makaramdam ng pain sa jaw, sa cheek, and even around the eye. So, sobrang sensitive ng nerves natin. It can overreact sa mga stimulus. Kahit madampian ka lang, masakit na. Mag-toothbrush ka lang, masakit na. And even if mahanginan lang yung face mo, masakit na siya. Kasi ganun nga ka-sensitive yung nerves natin. Ito naman sa castalgia. Intense din naman siya, pero in a burning type of way. Tapos, it can be triggered by small, harmless things, kagaya ng pag ma-feel lang ng cloth, ng skin mo yung cloth, masakit na siya. Kasi ganun nga, again, ka-sensitive yung skin natin. So, yung usually normal naman na sensation, nararamdaman natin araw-araw, it can be very painful na for those people who have this type of syndrome. Pag phantom limb pain naman, for me, it's actually confusing yet fascinating itong pain na to. Kasi the pain comes from a limb that has been removed or that is not functioning anymore. Kasi, meron pa rin tayong nararamdaman na sensation or pain doon sa limb na na-remove na as if it's still there kahit wala naman na talaga. And sabi rin sa book that most patients na nakaranas na ng amputation, sinasabi nila na yung pain na nararamdaman nila is the same as the pain na nararamdaman nila before ma-amputate yung limb na yun. So, what makes it even more challenging na to understand is because the pain comes from a body part that does not exist anymore. So, parang yung brain natin, nagsasend pa rin siya ng signal, nandun pa rin yung limb na yun. Kaya tayo nakakaramdam ng sensation and ng pain. And it can be very severe na pwede umabot for months up till years. Next, we have massages. Some people evidently like pain, at least under some, usually sexual circumstances. Yeah, okay, so these people, they find pleasure in pain, usually in sexual circumstances. And psychologists think that it is because of what we call classical conditioning. Yung kay Pavlov kasi they experience two things at the same time. And in this case, yung pain and pleasure yun. Paulit-ulit kasi nila yung nararamdaman ng sabay. So, yung response nila sa pain is nag-iiba siya. Like, if it's your first time being engaged sa mga sexual activities, syempre sa una, hindi ka talaga 100% comfortable, merong fear, ganyan, pero along the way, pag naulit siya na naulit, you'll eventually come to enjoy it. And, kasi nga, you learned na how to expect pleasure after pain in those specific situations. Okay, Henry Bitcher. Yeah, another example of how the meaning of pain affects people's experience of it is yung ginawa ni Henry Bitcher. He's a physician. Wala na to sa PPT. I'm just going to discuss na lang kung ano ba yung ginawa niya. So, during World War II, he treated soldiers with serious physical injuries sa isang hospital field. And then, nagulat siya kasi half of them, or 49% of them lang, yung nag-claim that they experience moderate to severe pain. Tapos, 32% of them, yung nangailangan lang ng pain medicine. And then after a few years, he studied civilians who undergone surgeries with the same type of wounds. And yung naging result niya is 75% of them claimed that they experienced moderate to severe pain, tapos 85% of them naman wanted pain medicine. So nagulat siya kasi bakit daw parang yung mga civilian mas nakaramdam pa sila ng pain kumpara doon sa mga soldiers, mas malala yung mga injuries na nakuha ng mga soldiers. And the answer to that is because of how the soldiers and the civilians viewed their pain. For the soldiers kasi, they've been in constant danger. They've been fighting for weeks. So yung mga injuries na nakuha nila, mga sugat na nakuha nila, parang indication daw yun that it's all over, that they can finally come home to their families. Pero, doon sa mga sa mga civilian, for them, yung mga injuries na natamo nila, parang it marked as the beginning of a difficult period. Like for them, napakalaking problem and disruptions nun sa mga buhay nila, kaya mas intense yung pain na naramdaman nila. And we have here also the specificity theory and pattern theory. So, dito sa specificity theory, sinasabi niya that our bodies have its special system just for pain. Mayroon daw sariling pain receptor, may sariling nerves for pain, and then ang brain daw natin is mayroong dedicated na part para lang sa pain. Pero this idea, or this theory is not correct kasi our body does not have its own system or special system just for pain. Instead, pain uses the different parts of our body and also brain that handles pain sensations. Dito naman sa pattern theory, for example, both a hard hit and a gentle touch, they use the same nerves, pero they create different activity pattern. Like for gentle touch, yung pattern na nakikreate, lang siya, mild lang. So, yung feeling natin doon, pleasant lang, soft lang siya. Pero pag hard hit, ang pattern na nakikreate is intense. It's strong, which our brain recognizes as pain. So, according to this theory, it is not the type of sensor that makes something painful, but the intensity and also the pattern that goes through our brain. Next, we have called pressor procedure. Okay, so this procedure, it was used by the researchers to know kung paano ba tayo mag-manage and also paano tayo mag-cope with pain. And dito sa procedure na to, gumamit sila ng special device I look it up sa Google kasi wala siya sa libro, pero ang sabi lang is called pressure tank, something like that. So, dito sa procedure na to, kailangan yung mga participants, kailangan nilang i-dip yung arm nila sa ice cold water na yung temperature is nasa 2 degrees Celsius or 25.6 degree Fahrenheit. Pero before nila gawin yon, before nila i-dip sa ice cold water yung arms nila, kailangan muna nilang ilagay yun or i-dip sa room temperature water for about a minute to ensure lang that the skin starts at a neutral temperature. And then habang ginagawa yun, na-explain na din sa kanila kung ano yung mga mangyayari. They answer questions from the participants and they also let them know that if ever merong changes sa skin color, it's totally normal. So, paano ba natin i-measure yung pain ng mga participants? We only have 2 ways. Una, we can ask them to rate their pain. Pangalawa is how long they can dip their arm doon sa ice cold water. So, yung mga participants na nag-undergo na ng nag-undergo na ng first procedure, ng first test, they were divided into 2 groups. Kasi iti-test nila again yung pain ng mga participants na yon, but this time with the presence of positive self-talk. So for group 1, they receive statements such as, I can handle this, or this is not the worst thing that can happen, na ganyan-ganyan. For group 2 naman, they also received the same statements, pero it was explained to them kung ano ba yung purpose or yung ano ba yung importance ng positive self-talks when it comes to handling pain in a better way. So, yung result, syempre, for group 2 na parang nabigyan ng explanation about the importance of positive self-talk, nag-decrease yung pain nila from test 1 hanggang test 2. Pero for those, people or participants, which is in group 1, na hindi na-explain sa kanila kung ano ba yung importance ng positive self-talk, yung first test hanggang second test nila, nag-increase pa yung pain nila. Next, we have muscle ischemia. Next, we have muscle ischemia. Pag sinabi natin ischemia, it's lack of blood flow. So, dito naman sa procedure na to, ang ginamit dito na device is sphygmomanometer, yung pang BP. So, yung gagawin dito is, yung cuff nun, yung sphygmomanometer, ilalagay siya sa arm ng participant, and then dapat yung pressure nun is nasa 240 mmHg or millimeters of mercury. Pero before yun, kailangan mo nang i-lift yung arm ng mga participant para matanggal yung mga excess na blood. And then, pag nakaka-cuff na siya, pag nag-start na yung procedure, it will create feeling of numbness, magkakaroon throbbing, and also magkakaroon ng changes sa temperature. And then, again, paano natin ma-measure yung pain nila? Una, self-rating, and also kung gaano ba nila katagal kayang endure yung pain. And then, after nung pagka-cuff, pag tapos na yung procedure, gagawin lang is tatanggalin yung cuff, and then, i-raise ulit yung arm ng mga participant para mag-return yung blood flow nila in a normal way. Yun lang siya. Also, pain is measured by self-ratings or how long a person endures the discomfort. A variation of this procedure inflates the cuff only until the person first feel pain, helping assess their pain threshold. When we say pain threshold naman, it is the point at which pain is feel first. Tapos, next, itong pain ethical standards, I'm not going na to discuss about this kasi given na yan, mabilis na lang maintindihan yan. Next, we have the gate control theory. Okay, so this theory, it combined ideas from the previous theories about pain and improve upon them by explaining how both physiological and psychological factors can influence our experience of pain. And itong theory na to, nag-propose siya ng tinatawag nating gate. Hindi ko rin babasahin yung gate, pero ang gate, it is parang checkpoint kasi it either allow or block a pain signal to pass through our brain. Meron kasi tayong tinatawag na open gate and closed gate. Ibig sabihin nun, all pain signals does not lead to the same experience of pain. Kasi pag open gate, ibig sabihin nun, more pain signals pass through the brain. So, pag mas marami yung pain na nagpa-pass through, mas intense yung pain na mararamdaman natin. Pagka closed gate naman, ibig sabihin nun, less lang yung pain signals na nagpa-pass through sa brain, kaya less intense lang din yung pain na nararamdaman natin. Now, where is this gating mechanism or gate located? It is located in the spinal cord, specifically in the substantia gelatinosa of the dorsal horn. So it's a region in the dorsal horn of the spinal cord, which is responsible then for processing sensation, specifically pain and temperature. And it is also a part of the gray matter, which runs the length of the core and the spinal cord. And then, after na mag-pass through ng mga pain signal sa brain natin, i-activate naman ito yung tinatawag nating transmission cells, which send impulses to the brain. So the gate control theory of pain suggests that there is a gate in the spinal cord that can control how much pain signals gets through the brain. And then we have the amount of activity in the pain fibers, the amount of activity in other peripheral fibers, and messages that descend from the brain. Dito naman sa neuromatrix, it is a complex network of the brain that work together to process pain. Pero hindi lang siya nagre-rely sa mismong pain signals. Nagre-rely din siya sa sensations, thoughts and emotions, and also stress regulation. Kasi nga, di ba, how stress or how relaxed we are can also affect our experience of pain. And then next we have, okay, ito. Yung gate control theory kasi, it got a lot of attention because of how it explains how the body and the brain affects our experience of pain. And one study of David Reynolds showed this with rats. So, unang-una, yung ginawa niya ni Reynolds, naglagay siya ng maliliit na electrodes sa mga specific parts ng brain ng mga daga to test lang if meron ba silang mafe-feel na pain if ikaklamp niya yung buntot nila. And as expected, lahat naman ng daga nag-react. Lahat sila nakaramdam ng pain. And then a few days after that, nag-decide siya na mag-send ng electric current doon sa electrodes to test if meron bang magiging effect doon sa pain ng mga daga pag kinlamp niya ulit. So, nung kinlamp niya ulit, most of them, nag-react pa rin naman. Most of them, na-feel pa rin naman nila yung pain. Pero those rats na hindi nag-react, lahat ng electrodes is naka-place sa specific area ng brain nila or yung tinatawag natin periaqueductal gray area. Tapos, since nakita niyo na hindi sila nag-react lahat dahil doon nakalagay yung electrodes, ang ginawa niya is nag-conduct siya ng abdominal surgery doon sa mga daga na yun habang gising sila. And of course, with the electrodes being active. And then, habang ginagawa niya yung procedure, walang nag-react sa kanila. Parang walang nagbibigay ng sign na nasasaktan sila. So, it demonstrates that the stimulus is enough to block the pain or yung tinatawag nating analgesia. Also, further research confirmed that activating the periaqueductal gray area can block pain in both animals and humans. And they also found that painkillers such as morphine works by triggering the brainstem to send signals down the spinal cord, which blocks pain in a similar way. For our next topic, may we have Miss Apilit. Thank you guys for listening. Take it away.
So, hello everyone. Na-assign sa akin yung topic na to report this to all of you, which is my topic is biopsychosocial aspects of pain. So, pain is not just a physical sensation. Hindi lang to basta-basta pain na nararamdaman natin physically. It involves the biological, psychological, and social factors na nag-i-interact sa isa't isa. So, hindi ito basta masakit lang. May malalim na dahilan nito sa katawan natin, sa isip natin, at sa paligid natin. And understanding these factors is crucial for effective pain management. Let's start sa biological aspects. So, ang katawan natin ay may mga chemicals na involved sa pagpapadala at pagpapakalma ng mga sakit na nararamdaman natin. And we have the stimulation-produced analgesia or the SPA. So, ano nga ba itong SPA na to? It's an electrical stimulation of periaqueductal gray area of the brainstem triggers a neurochemical chain reaction. As you can see guys, meron tayong illustration dito. Ayan. From periaqueductal gray area. And then we have the neurotransmitter, which is the serotonin that activates magda-down siya papunta sa spinal cord natin na i-activate niya yung nerve cells natin, which is the inhibitory interneurons. And those inhibitory interneurons, magdi-release naman to ng endorphin na neurotransmitter papunta kay pain fibers. And si pain fibers, magre-release naman ng substance P papunta kay transmission cells. And si transmission cells, magsisend naman na ng signals pabalik sa utak natin. So ano nga ba si substance P? So responsible for sending pain signals to our brain. So si substance P, parang messenger natin siya sa katawan natin. Na halimbawa, may sakit akong nararamdaman dito. May sugat ako dito. And then, bago ko maramdaman yung sakit ng sugat na yun, mag-create muna ng chain reaction yung katawan natin. And then, magsisend na ng signal si substance P papunta kay periaqueductal gray area natin sa utak natin. Once na na-receive na ng brain natin yung signal na yon, doon ko mararamdaman na may masakit pala dito. Kasi si substance P, nag-report siya kay brain na, hey, may masakit dito. So once na na-receive na yun, doon ko mararamdaman na, may masakit pala dito sa part ko na to. May masakit pala sa part ko na ito. May masakit pala yung sugat ko, makapdi pala yung sugat ko. So, dahil yun kay substance P. Ay nakakaramdam tayo ng sakit dahil kay substance P. And then, kung may signals naman nagsisend sa utak natin para maramdaman natin yung sakit, meron din tayong endogenous opioids, kung saan ito yung natural painkillers ng katawan natin. So, nag-a-activate ito kapag nag-stimulate ang periaqueductal gray area natin sa brainstem. Nagre-release naman ng katawan natin ng endogenous opioids para makatulong sa pain na nararamdaman natin. Kumbaga, si endogenous opioids is nare-reduce niya yung pain or binibigyan niya tayo ng pain relief sa katawan natin once na may nararamdaman tayong sakit. And yung mga taong may mga chronic pain, which is yung mga taong may mga sakit na chronic pain, meaning yung pain nila naglalas ng matagal. Kasi meron silang mga problems sa natural painkillers nila, sa mismong endogenous opioids nila. And yung body nila, hindi nila na enough yung chemicals na lumalabas or yung mga receptors na sa katawan natin, hindi masyado nila nare-receive etong mga to. Kaya kaya mas naglalas yung pain na nararamdaman nila. And merong mga instances na pwede pang maging worse or maging sensitive yung pain na nararamdaman nila kasi impaired yung endogenous opioids nila. Another example naman, kapag sa endogenous opioids, halimbawa nahulog ako sa bike and then nagasgasan ako. So may rush pain ng signal na pupunta sa utak ko na tinatawag na si substance P. So nagki-create na yun ng chemical reaction. Pero dahil nag-release din yung katawan ko ng endogenous opioids, unti-unti kong nararamdaman na kumakalma yung sakit ko. So ganun magwo-work itong tatlong ito. Next, punta naman tayo sa psychological aspect. So, hindi lang physical ang pain, may psychological side din ito. So, learning and pain. We learn to associate pain with antecedent cues and consequence, especially if the pain is severe and repeated. Example, if you had a painful experience at the dentist, you might start feeling anxious by seeing the dentist's office or hearing the sound of the drill. So, yung mga experience natin na yung psychological aspect natin sa mga experience natin. Kumbaga, naapektuhan na yung pag-iisip natin dahil yung perception natin sa mga past experience natin. Halimbawa na lang na eto nga, yung may painful experience ka sa dentist mo. So, baka kasi yung experience mo dun sa dentist mo is masakit, malala yung naging experience mo dun and ayaw mo na maulit. So, kapag babalik ka sa dentist mo, every time na may isip mo yung napupunta ka uli sa dentist, maaalala mo yung nangyari sa'yo, which is the experience mo na painful. And then, you start feeling anxious na kapag ganun. And then, ganun naapektuhan ng mga nasa paligid natin ang perception natin. And then, another example na lang is kung takot ka sa injection and just seeing by the needle minsan is nararamdaman mo na yung sakit kahit wala pang natuturok sa'yo. Ganon. Kasi siguro may experience ka sa needle na sobrang sakit kasi siguro yung nurse mo mabigat yung kamay tapos nung tinurok sa'yo sobrang bigat and sobrang sakit. Kaya nung next na pumunta ka, pag nakita mo na yung needle, ganun na yung maiisip mo. So, may tinatawag tayo dun yung tinatawag na anticipatory anxiety. Yun yung tinatawag natin sa mga ganong experience natin. Kasi nagiging anxious na tayo and parang yung perception natin sa pain ganun na lang dahil dun sa dahil dun sa nangyari sa atin. And then we have the pain behaviors. Yung pain behaviors is nakaklasify siya sa 4 types ayon kay Tour and Kearns sa isa din ni ano. So we have the facial or audible expression of distress. And second, we have the distorted abulation or posture. Third, we have the negative affect. And lastly, we have the avoidance of activity. So, yung pain behavior is nakaklasify siya sa 4 types, which are itong mga to. Sa facial or audible expression of distress, so makikita mo yung pain behavior na to kapag yung tao nakikita mo nagki-clench ng teeth nila, nagmo-moan or nagre-grimace. So, di ba kapag masakit yung ulo natin, nakakunot yung ulo natin, nakakunot yung noo natin. So, that's the example of the facial or audible expression of distress. Yun yung example ng pain behavior. And then, sa distorted abulation or posture, simple lang. Kung kapag may makikita kang diba sa ating mga babae, kapag namimilipit yung puso natin, nagkakaroon tayo ng menstrual cramps. Yung posture natin, gusto nakabaluktot lang tayo. Yun yung tinatawag na, isa yun sa mga pain behaviors na nakaka-classified as distorted abulation or posture. Or kaya kapag masakit yung tiyan natin, di ba? hinahawakan natin siya. Hinahawakan natin yung tiyan natin sa masakit na part. Malamang sa tiyan natin. Yun, hinahawakan natin. And pain behavior also have negative effect. So, yung mga behavior natin kapag may pain na nararamdaman tayo, nagiging irritable tayo, or hindi tayo nakakausap, laging parang galit ka sa mundo, ganun. Basta irritable ka. So, yun yung negative effect ng pain behavior. And we have the avoidance activity. So, example na lang dito na, let's say si Mark, may back pain. And every time na masakit ang likod niya, he tends to lie down o hindi na siya lumalabas. Kasi, ina-avoid niya na yung activity. Like, sabihin na natin si Mark, yung trabaho niya kasi construction worker. So, syempre kapag construction worker, kasama na talaga yung pagsakit ng likod mo dyan. So, kapag ganun yung nararamdaman niya, na masakit yung likod niya, yung pain behavior niya is ina-avoid niya na lang yung activity na yon na nakapagpapasakit sa kanyang likod. Ganon. So, ito makikita natin yung mga pain behaviors. Meron dito, ito may menstrual cramps to na hinahold niya yung painful area which is yung puson niya. And then yung posture niya, nakabuluktot lang siya. Tapos, yung noo niya parang nakakunot pa siya. And then, ito, masakit yung ulo niya. And then, hinahawakan niya yung part kung saan masakit yung ulo niya. And then, eto, yung posture niya din, nakabuluktot siya kasi siguro masakit yung tiyan niya. Ito yung tinatawag natin na yung posture sa pain behavior. And then, ito sa back pain din. Ganon. So, people in pain often display these characteristic behaviors. These behaviors can be reinforced through operant conditioning, leading to entrenched patterns that contribute to chronic pain. So, kapag lagi nating nararamdaman yung mga pain na yun, yung kung ano yung behavior natin na nakasanayan, ganun na lang lagi yung ginagawa natin. Ganun na lang lagi yung pain behavior na ginagawa natin tuwing nakakaramdam tayo ng sakit. For example na lang kapag masakit yung ulo natin, di ba? Kapag madalas yung ginagawa natin kapag masakit yung ulo natin is natutulog na lang tayo. Ayun. That's the example of pain behavior. Or kaya hinihilot natin. Yun. Example na rin yun ng pain behavior. So, nare-reinforce siya through operant conditioning. Yung mga pattern na yun. So, social factors such as attention, care, and care can also reinforce pain behaviors. So, yung kapag nakakatanggap tayo ng attention and care, mas na-express natin yung pain, mas na-express na natin yung mga pain behaviors na to. Dahil yun sa social factors na natatanggap natin such as attention, care, and love sa mga family or friends, siblings, ganun natin. Punta naman tayo sa social aspect ng pain. So, social factors tulad ng support mula sa family natin, sa kaibigan natin, ay may malaking epekto sa pain experience natin. Example na lang, Example na lang si Sarah that frequently mentioned her knee pain to her family, and each time she does, they offer her extra help like doing chores for her and encouraging her to rest. And over time, Sarah begins to rely more on expressing her pain because she receive attention and care every time she does. So ganun kalaki yung ganun kalaki yung epekto ng social natin kapag nakakaramdam tayo ng pain. So kapag ano, kapag every time na binabanggit ni Sarah na may sakit siya, nakakatanggap siya ng extra support kapag may pain siya na nararamdaman. Gano'n nai-influence ng social natin yung yung perception natin sa pain. And kapag minsan nga, ginagawa natin para makatanggap lang tayo ng attention sa mga taong nakapaligid natin, minsan minsan exaggerated na yung natin ng mga pain behaviors kasi gusto lang natin makatanggap ng attention and care sa mga taong nakapaligid sa atin. Next, we have the gender and sociocultural factors of pain. So, even things like gender can affect how we experience pain. Ayon sa study, women tend to report more pain than men and more likely to experience certain types of pain like migraines. Kaya yung mga researchers believe na yung mga babae is may lower baseline level of opioids kaya yung receptor nila mababa yung kaya yung mga babae is sila yung madalas nakakaramdam ng migraine kasi sila yung sensitive and mas greater yung perception nila ng pain kapag nakakaramdam sila ng isang sakit. Mas severe yung nararamdaman nila compared sa mga lalaki. And kung pupunta naman tayo sa socio-economic status, kapag pupunta tayo sa economic status, people with less money tend to experience more pain. Bakit kaya na mas nakakaano ng experience yung mga pain yung mga taong less fortunate? Because 'di ba kapag may pain tayong nararamdaman, the reason is hindi natin kayang ipagamot yung sakit na nararamdaman natin. So, compared sa mga taong fortunate, may means sila para pumunta sa ospital kasi kaya nilang magbayad sa bills nila, ganun. Pero yung mga taong less fortunate is hindi nila kaya eh. So, mas na-experience nila yung pain compared sa mga taong may mga kaya. And then, sa cultural factors naman, people, some cultures experience the pain differently. So, halimbawa na lang yung mga Americans na sa study na yung mga Americans is reported na marami silang work. And may mga problem dahil sa mga trabaho nilang yun is nagre-report na marami silang problem sa back pain kumpara sa mga countries like other countries kasi may surveys ng different countries who suffer from chronic low back pain revealed greater work and social impairments among American, followed by the Italians, New Zealanders, and Japanese and Mexican individuals. Sa sa United States naman, yung mga African Americans showed less tolerance, less tolerance for muscle ischemia pain and reported higher level of chronic pain than whites. So, yung mga African Americans is mas less yung nafi-feel nila sa mga muscle nila. Pero mas higher level sila ng chronic pain than whites. Next, we have the emotions, coping process, and pain. So, pain and emotion are closely linked. Mas malapit sila sa isa't isa. Kapag mataas yung anxiety, high anxiety can influence expectation and memories of pain, leading to exaggerated pain perception. So, example na lang, di ba kapag mataas yung kapag mataas ang anxiety natin, ang perception ng pain ay nagiging mas matindi. Ganito rin kapag may depression, anger, or stress. So, ang mga cognitive process natin, tulad kung paano natin isipin ang pain, may malaking impact. Di ba kapag minsan may pain tayo nararamdaman tapos nai-stress tayo. Kapag nai-stress tayo, mas lumalala yung pain na nararamdaman natin. Halimbawa na lang may headache ka. So, iniisip natin na masakit yung ulo natin. And then, namamalayan na lang natin na mas lumalala. So, ganun na apektuhan ng pag-iisip natin yung pain, yung perception ng pain natin. And halimbawa na lang, mataas yung stress level mo. And then, kapag mataas yung stress level mo, mas nagiging sensitive ka sa pain. Ganon na apektuhan ng emotion natin yung cognitive process natin. So, does emotion affect the pain? So, chronic pain is often associated with emotional distress, including depression, anxiety, and anger. So, di ba kapag, tulad nga ng sabi ko kanina, kapag may sakit tayo, is nai-stress na tayo. Kapag nai-stress tayo, adi mas naapektuhan yung pain na nararamdaman natin. Mas lumalala siya. Next, coping with pain. Part of the stress that chronic pain patients experience stems from their common belief that they have little personal control over their pain. Aside from avoiding the activities they believe can trigger an attack or make it worse. So, may iba't iba tayong coping mechanism kung paano natin yung pain natin. Sometimes yung mga taong may mga taong maano yung malalakas yung loob nila, they believe na nakokontrol nila yung pain. And then, gumagawa sila ng mga activity to distract themselves sa mga pain na nararamdaman nila. Ina-avoid and also ina-avoid nila yung mga activities na puwedeng makapagpa-trigger sa pain na yun. In that way, nagko-cope sila sa pain na nararamdaman nila. Next, meron tayong tinatawag na pain acceptance. Involves sa being inclined to engage in activity despite the pain and inclined to control or avoid the pain. People with high level of pain acceptance pay less attention to their pain and have a greater self-efficacy for performing daily tasks, function better, and use less pain medication than worse with low pain acceptance than those with low pain acceptance. So, yung may mga taong na-accept nila yung pain nila. And then, 'di ba kapag na-accept natin yung pain natin is gumagawa na lang tayo ng mga activity na nakakapag-distract sa atin sa sakit na nararamdaman natin. And then, sabi sa research na mas nagfa-function sila kumpara dun sa mga taong mababa yung mababa yung pain acceptance nila and mas mas nakakapag-engage sila sa mga activities and sometimes ito yung makikita mong yung kahit may sakit na yung isang tao, positive pa din sila. Kasi ina-accept na lang nila yung pain nila. In that way, kapag na-accept nila yung pain nila, dinidistract na lang nila yung sarili nila. Yung meron pa nga yung mga ibang tao na kahit 'di ba nasasaktan na, tumatawa na lang. Kasi meron tayong 'di ba kasabihan na laughter is laughter is the best medicine. Ayun, 'di ba? Kaya gano'n yung pain acceptance. So, that's it. That's my report. I hope na may natutunan kayo. And next is assessing people's pain, which is ire-report ni Justin. So, yeah, thank you guys.
Hello guys, good day. So I was actually tasked to present to you assessing Spain. So let's start. So there are actually different varieties of techniques used for assessing people's pain. And these methods can be applied obviously sa paggagamot ng mga patients na may iniindang sakit. Madalas actually ginagamit din siya sa mga researches or pananaliksik. While for others, they use these techniques to supplement a detailed medical history. So bakit nga ba kailangan nila itong mga assessment na to supplement a detailed medical history? Because guys, kailangan ng mga doctors ang mga information na to be able to know what's the perfect technique or tool na gagamitin nila to treat these patients. Actually, according to Bradley, to ensure the accuracy of the assessment, it is a good idea to use two or more techniques, which is something na hindi na bago sa paninig natin since na-take up na natin yung psychological assessment. Sabi nga naman Iya, excuse me, disclaimer, iba kasi pakiramdam ko ngayon, so sorry. Okay, so sabi nga naman Ian, ano, to be able to know the accuracy and the reliability of the assessment, it is a good idea to use two or more techniques. Yeah. So, okay. Next slide tayo. Ayan. So, let's proceed with classifying ways to measure pain. There are actually three ways to measure pain. We have the self-report methods, behavioral assessment approaches, and psychophysiological measures. Let's start first by discussing self-report methods. Okay, so self-report, guys, paulit-ulit na sinasabi sa atin yan for sure. I mean, alam niyo na kung ano yung self-report. It is an obvious approach to measure people's pain. So, bakit nga ba obvious approach siya? Kasi in here, guys, we ask the patient to describe the discomfort na nafe-feel nila. By how? Either in their own words or by filling out a rating scale or questionnaire. So, kung mo you guys yung naitakbo na sa hospital, siyempre aside nung pinanganak tayo, meron ba? Or, sige, sabihin na lang natin, I mean, for sure, nakapanood naman na kayo ng mga medical drama, di ba? Pag napapansin nyo, kapag dumating yung mga patients, di ba, ang humaharap sa kanila yung mga healthcare workers, tinatanong ng mga healthcare workers, i-interviewin actually ng mga healthcare workers yung patient. Natanong nila kung ano yung masakit, saan part yung masakit, gano'n siya kasakit, and when it tends to occur. Take note, itong mga questions na 'to, itatanong 'to kapag yung pain na na-experience ni patient is acute. Kasi guys, magkaiba ang method ng interviewing sa mga patient na merong acute pain sa mga may patient na merong chronic pain. So, kapag chronic pain naman na na-experience the patient, they actually ask a structured clinical interview. Meaning, may methods, may format na sinusundan itong mga healthcare workers na itatanong kay patient. Di ba nga? I mean, naalala ko lang, natatawa kasi ako kasi ako din naman, naasar din ako no'n kasi bakit kailangang i-interviewin mo na yung patient bago muna bigyan ng treatment, 'di ba? Kasi parang dumudugo na nga yung patient, tatanungin mo pa ng about ganito, ganyan, 'di ba? So, i-interviewin pa. Which is, na-realize ko, oo nga naman, kailangan naman kasi itong mga information na 'to, eh. Kasi itong mga information na 'to, puwede nilang malaman na ito yung source kung bakit nagkaroon ng ganitong pain sa patient, like that. Okay, so interviewing methods in assessing pain. To treat chronic pain effectively, professionals need more information than a description of the pain. So, aside from interviewing the patient, guys, they also need to gather information sa mga tao malalapit sa atin, like our family member, or di kaya friends, or di kaya coworkers. These informations kasi na magagaling sa kanila is important to early stages ng treatment. Kasi pwedeng this will help to know kung saan nanggaling yung pain condition na to, like that. Okay, this discussion ordinarily focuses on such issues as the history of the pain problem, including when it started, how it progressed, and what approaches have been used for controlling it, the patient's emotional adjustment currently and before the pain syndrome began. Ibig sabihin, meron bang coping strategies? Meron bang coping skills and coping way na ginamit si patient nung before siya nagkaroon ng pain condition na 'to, hanggang ngayon na ongoing pa rin yung pain condition, like that, excuse me. Okay. The patient's lifestyle before the pain condition began, like recreational interests, exercise pattern, diet, and so on. Ibig sabihin, before ba nagkaroon ng pain condition, mahilig ba si patient mag, volleyball, mag-basketball, or mahilig pa siyang mag-diet, or mahilig siyang mag-exercise na madalas siyang nasa gym, mga ganyan. Kasi puwedeng ito yung source or the, um, factors kung bakit nagkaroon ng pain condition itong mga patient na 'to. The pain symptoms impact on the patient's current lifestyle, interpersonal relations, and work. Nagkaroon ba ng impact sa work niya? Like, hindi na ba siya nakakapasok? Or di kaya hindi na siya as productive as before? Mga ganyan. And in terms of interpersonal relation, bumaba ba yung self-esteem niya? Mga ganyan. A social context of pain episodes such as happening in the family before an attack and how family members respond when the pain occurs. So meaning, pag nagkaroon ba ng pain attack sa ganito, meron bang family support na natatanggap si patient? Ganyan. So factors and support that seems to trigger attacks or make them worse. How the patient typically tries to cope with the pain. Itong mga question to guys, again, ito yung mga madalas na itanong na interview nila kay patient. And aside sa information nga na makukuha kay patient, kailangan din nilang makakuha ng information. Same question, itong mga information na ito makuha sa mga taong nakapaligid kay patient. Like, tulad sabi ko nga kanina, puwedeng coworkers, puwedeng, friends, or puwedeng, ah, ano ba, basta yung mga taong malapit dun sa patient mo na yun, i-interview nila. Okay. Pain rating scales and diaries. A direct, simple, and commonly used way to assess pain is to have individuals rate some aspect of their discomfort on a scale. And itong mga approach na to actually is, ito yung madalas na gamitin to measure kung gaano ka-strong yung pain. So we actually have three different types of scales for rating pain intensity. We have visual analog scale, box scale, and verbal reading scale. Dito sa visual analog scale, as you can see sa picture, no, i-rate ng tao yung pain na na-experience nila by marking a point dito sa linya na to na merong labels bawat dulo. Actually, itong scale na to is napakadaling gamitin. Ito actually yung pinakamadaling gamitin sa tatlo. That's why, sa sobrang dali niya is pwede siyang sagutan as young as 5 years old. Okay? So again, itong sa dulo, low pain, sa dulo yun yung pinakamataas na pain. So, ino-mark lang ni patient kung nafe-feel niyang intensity ng pain na nafe-feel niya that time. Okay. So, next is box scale. From the word box, ibig sabihin may mga provided na box. And then sa loob ng box, naka-indicate yung number, which means parang, yeah, it indicates the intensity ng pain. So, pag 1, pag walang pain, pag yung 10, which is the highest, kapag yun na yung pinakamataas na pain, ganyan. So, next is the verbal rating scale. The word verbal rating scale, ibig sabihin, um, merong provided na mga word or phrase dito that describe yung intensity ng pain na na-experience ni patient. So, mamimili sila ng mga words dito again and mga phrase na mag-describe nga no na-feel nila that time. At, dahil nga mas madalas na, I mean dahil madali na ang paggamit nitong mga 'to, madalas na ginagamit itong mga rating scales na 'to, which is, magiging I mean, naging magandang way siya para mapadali na yung mga trabaho ng healthcare workers natin. And actually, kapag multiple times na ginagamit ng mga rating scale na 'to, mas accurate yung results. Because guys, you have to take note na ang pain, nagfa-fluctuate yan, 'di ba? So, kung kanina mataas yung intensity ng pain mo, puwedeng mamaya mababa na yan. Kaya nga, repeated ratings reveal pain changes over time. For instance, mayroong situation na nabanggit yun sa resources natin where one patient's wife believed na yung asawa niya is nakaka-experience ng severe pain every waking hour of his life. Kasi yun nga yung sabi nung asawa niya. So, ang ginawa nung babae, sabi niya, okay, huwag ka na magtrabaho or kapag may mga mabibigat na bagay dyan, yung hindi niya na pinapatrabaho yung lalaki. So, ang nangyari nun, dumating sila sa point na, I mean, hindi, I mean, yeah, dumating sila sa point ng buhay nila na bumaba na yung estado ng buhay nila. And with that, nagkaroon sila ng 4 years na depression. Pareho sila. Kasi nga, yun nga, wala na silang trabaho, naghirap sila, and ganyan. And then, nakita nila tong scale, tinry nila. And, dun sa scale na to, it shows na moderate pain lang pala yung na-experience nung lalaki. So, it shows how important is this skill. Kasi kung nung una pa lang, na-try na nila 'to, hindi na sila aabot sa 4 years na depression, 'di ba? So, repeated readings during each day may also reveal patterns in the timing of severe pain. So, ibig sabihin, yung pain ba na na-experience mas malala pa pag morning or mas malala siya pag gabi? Or di kaya, meron bang factors or responsible ba yung environment dito sa mga pain na na-experience? Pwede ba siya magbago? Mga ganyan, malalaman natin yan. So, okay. Pain ratings can also be used in pain diary. So, ano nga ba itong pain diary? It is a detailed record of a person's pain experiences. So, para siyang logbook eh. Para siyang logbook kung saan nakalagay din yung time, kung kailan mo naramdaman yung pain, saang part, activity yung ginawa mo kaya nag-start yung pain, medicine na tinake mo, and yung rate ng, the intense, the range ng time bago nag-recover yung pain. Wait lang. Okay, I'm back. Ayan. So, ayun nga, tulad ng sabi ko kanina, itong pain diary na 'to, dito nakalagay yung mga informations na, um, mga informations na nangyari while informations na parang it's a tally ng mga, informations which is important para malaman mo yung pain na na-experience mo that time. And it's perfect. Actually, ang bongga nito kasi dito malalaman mo, mamo-monitor mo actually yung mga pain experiences mo nung mga time na yun, di ba? And makikita mo din kung consistent ba na tuwing ganitong time nagkakaroon ng recovery or yung range ng time may recovery and parating ito ba yung pain na na-experience mo sa part pa na ito, ganyan, di ba? Okay. Pain questionnaire. Pain is the intensity of the discomfort people feel. Melzack began to recognize the multidimensional nature of pain through his interaction with pain patients. In fact, no, describe niya na yung interview nito, it start dahil sa um, realization ni Melzack while talking to a patient who suffered from phantom limb pain. If you guys don't have idea about phantom limb pain, ito yung mga tao nakakaramdam ng sakit sa limb nila kahit na wala naman ito. Meaning, amputated yung feet nila. 'Di ba? It sounds crazy pero guys, it really happened. So, sabi nga nung interview niya na meron daw siyang na-experience na super sakit daw yung pain, anong limb niya, na parang meron daw bakal, mainit na bakal tumutusok dun sa limb niya kahit na wala naman siyang limb. So, na-realize ni Melzack na ang pain is subjective. Kasi sabi niya, napakahirap naman na sukatin nung pain na yon in a objective manner. Especially nga, physically, wala yung paa, di ba? With that, Melzack determined that the pain involves three dimensions. We have the affective, sensory, and evaluate. And affective, which is the emotional or the motivational, we have the fearful, frightful, and terrifying. Which is, as you observe, these are the words that related to fear. Sensory naman, we have hot, burning, scalding, and searing. In here naman, these are the words that are related to temperature. Specifically, increasing hot temperature. So, hot, burning, scalding, and searing. Third one is evaluate, which is overall evaluate niya yung mga experiences niya dito. So, let's take for example, para mas madaling yung may calculate. We know that Manila is the most densely area in the Philippines, right? So, madalas yung mga bahay doon magkakatabi. And meron pang mga, may mga area na magkakatabi tapos gawa pa sa light materials. And that's why madaling pagmulan ng sunog at mabilis din kumalat, right? So, for those na informal settlers na nakatira mga informal settlers na usually kasi parang madalas nasusunugan sila. So, yung course ng experiences nila is fearful, frightful, and terrifying emotions. Natatakot sila para sa sarili nila, para sa mga mahal nila sa buhay, para sa mga bagay na nawala, and then para na rin sa kinabukasan nila. And this situation will lead them to trauma, di ba? So, this is part of the affective dimension. While in sensory dimension naman, during the fire, na-experience ng mga tao yung hot, burning, scalding, and searing feeling. And lastly, dun sa evaluate, sa evaluate dimension, in here ina-evaluate na nung mga tao yung na-experience silang pain and ano yung nagiging impact nito sa kanila and pati na rin sa long term na pagdadaanan nila, parang gano'n. So, McHill Pain Questionnaire or MPQ is an instrument to measure pain that was constructed by Mel Zhang. It is best known by most widely used pain questionnaire, but others are available. One of these is the multidimensional inventory, accurately assess people's pain and its psychosocial effects. So, actually, itong question na 'to, you can try this kasi meron 'to sa resources natin, which is page, ano nga yun? Ayan, page 325 under Assess Yourself. Ayan, so bibigyan ko kayo ng brief description na lang about this question kasi if you're going to look at it, sobrang self-explanatory na siya. Yan, as you can see sa picture, yan siya. Self-explanatory siya. So in part 1, um, may mga pictures ng body dyan wherein imamark lang natin kung saan part yung masakit. Part 2, merong 20 subclasses kung saan naka-indicate dyan yung mga descriptive words. Mamimili ka doon ngayon ng mga words na nag-explain dyan sa nafe-feel mo ngayon. Um, And ayan, so yung point ng 20 subclasses na yan is actually called the Pain Rating Index. Sa part 4 naman, ay nagko-contain siya ng series of verbal rating scales. And here, rate mo naman yung pain na na-experience mo right now. Tapos, yung score na yun is actually called the present pain intensity. Ayan. Madali lang siya, guys. Kung gusto niyo siya i-try, go ahead. Okay. So, behavioral assessment approaches. Because people tend to experience pain behaviors when they are in discomfort, it should be possible to assess their pain by observing their behavior. Psychologists have developed procedures for assessing pain behavior in two types of situation. We have everyday situation and structured clinical session. So let's start first by the structured clinical session. So in here, meron silang pinaperform na task kay patient um, and that with, I mean, i-observe siya ng mga healthcare workers na i-observe the healthcare workers yung behavior ng patient while performing those tasks. And that will help them assess yung pain na ng patient. Ganyan. So, UAB pain behavior scales is used by nurses during their standard routines such as in early morning rounds. So, in here, tulad nga ng sabi ko kanina, di ba? May pinapaperform silang task and then they are given 10 behaviors na i-rate nila in a 3-point scale. So, we have none, occasional, and frequent. Ibig sabihin, kapag in-observe nila yung ginagawang task ni patient, itong behavior na 'to, wala ba? Or nag-o-occur ba siya occasionally lang or frequent pang nangyayari itong behavior na 'to dun sa task na ginagawa ng patient? Mga ganyan. So, structured clinical session have been used in assessing discomfort in individuals with, excuse me, in individuals with a variety of pain conditions, including arthritis and low back pain. Each session has patients perform its a standard set of activities. Actually, no, sa isang study, pinagawa nila sa mga patient na merong low back pain, itong mga activity na to. Like, pinadampot nila ng pinadampot silang object dun sa floor, pinatanggal nila yung shoes nila while nakaupo itong mga patient, and also pinag-exercise nila. So, nangyayari itong mga tasks na 'to while naka-videotape sila and nire-rate din sila nire-rate yung pain behavior nila ng isang trained assessor tulad ng, um, nire-rate sila tulad ng, kung nira-rub ba nila yung area ng sakit or ngumunguwi ba sila, huminguwi ba sila, or bumubutong hininga ba sila. So, doon yung parang yun yung mga behavior na nire-rate nila or ina-assess nila, kinukuha nila to be able to assess more itong pain na na-experience. So, assessing pain behavior in everyday activities. In assessing pain behavior in everyday activities naman, we know kung paano nagbe-behave. I mean, we will observe here kung paano ba nagbe-behave ang isang tao. Like, sa bahay ba, mas maligalig siya, magaslaw ba siya, or nasa kama lang siya, maghapon siya nasa kama. So, family members or key others in the patient's life are usually the best people to make these everyday assessments of pain behavior. Kasi nga, magkakasama lang sila sa bahay. So, Wilbert Fordyce or Fordyce designed a procedure whereby the assessor compiles a list of 5 to 10 behaviors that generally signals when the patient is in pain. So, yung assessor na sinasabi dito is actually yung asawa. So, nakamonitor yung asawa sa behavior to keep track kung nag-exhibit ba itong pain ito. And itong procedure nito is actually very helpful, hindi lang sa pag-assess ng um, pain experiences by the patient, but also to determine yung impact sa buhay nila in a social context. Excuse me. Okay. Let's proceed in psychophysiological measures. So pain has both sensory and emotional components that can produce changes in bodily function. Psychophysiology is a study of mental or emotional process as reflected by changes they produce in physiological activity. Isa actually sa known, I mean, hindi daan. So, isa sa psychophysiological measures na ginagamit sa pag-assess ng pain is the apparatus called the electromyograph or EMG. So, ano nga ba 'tong electromyograph? It is used to measure the electrical activity in muscles which reflects their tension. So, of course, you guys know kung ano yung tension. Madalas nga associate natin siya sa sakit ng ulo natin, o yung low back pain, mga ganyan. Pag mas mataas yung EMG recording sa tension sa mga affected area or na muscle natin, it means that we are physically or psychologically stressed. So if you are stressed right now, I mean, mataas ang chance na mataas yung EMG recording ng tension nyo. Now, the question is, does EMG level reflect pain intensity? The answer is yes. Pero this will only happen kapag yung assessment na nangyari are taken in extended period of time. Meaning, kailangan ng more time to measure itong dalawang to. Kasi if making panahon lang yung gagamitin, hindi reliable yung correlation nilang dalawa. Okay? So, researchers have also attempted to assess people's pain with measures of autonomic activity, such as of heart rate and skin conductance, but these measures do not seem to be very useful. Bakit? Kasi yung changes sa automatic reaction sa katawan natin are more connected dun sa tingin mong intensity ng pain compared dun sa talagang nararamdaman mo. In short, guys, our body can react sa tingin natin na pain kahit na hindi naman talaga nandun yung pain. Or kahit na sometimes wala kang pain at all, di ba? So, tingin lang natin meron yung pain kahit na wala naman talaga. Ganun nagre-react kapag autonomic reactions. So, as a result, interpreting variations in autonomic activity as reflecting pain is often difficult. The last psychophysiological measure of pain is the electroencephalograph or EEG. It involves the electrical activity of the brain. So dito, ang mga example natin like clicking sound of the earphones or di kaya amoy yung perfume or pag nahawakan natin yung mainit na pot, mga ganyan. This will send signals sa ating brain where magpaproduce siya ng changes sa EEG voltage natin. And these electrical changes produced by stimuli are actually called the evoked potentials and show up in the EEG recording as sharp surges or peaks in the graph. If you guys notice the former reporter, they actually talk more or focus more sa pain experiences ng mga adults. Actually, ako din, di ba? So, but kahit na halos lahat ng discomfort na nafe-feel ng mga symptoms ay actually experienced din ng mga bata. So, now, sa next na slide natin, we are now going to focus sa pain in children. Ayan. Many children suffer from arthritis-like condition in their arms and legs that is called widespread pain or growing pains. The prevalence of widespread pain appears to increase from childhood to adolescence, but children typically outgrow the condition. So, ano nga ba tong growing pains, ano? There are actually no explanations na given sa book, so I had to look for the other resources. And according to Dr. Bellman's, excuse me, okay, according to Dr. Bellman's, growing pain are common and also affecting about 4 out of 10 children, typically between the ages 4 to 8. So, nangyayari ito dahil sa growing process. So, kapag nag-grow yung mga buto natin, specifically sa pag-grow ng mga buto natin, di ba? So, since namamanifest siya sa long bones natin, this means na yung pain is nararamdam natin sa lower limbs natin, di ba? Saan ba yung long bones natin, di ba? Sa lower limbs natin. So, madalas na nararamdaman yung pain tuwing gabi and kapag at rest yung bata. And in here, walang symptoms na makikita. So, walang swelling or fever, none at all. So, dapat yung pain resolves simultaneously. So, kapag matagal na yung pain, it means ibang sakit na yung na-experience ng bata. So, katulad ng sabi ko, no, walang symptoms na lumalabas. And, naramdaman mo lang yung pain na yun because nag-grow yung bone natin. Yun lang siya. And dapat hindi hindi matagal, hindi spontaneous. Ibig sabihin, hindi pa ulit-ulit, hindi parating na-experience ng bata tong pain na to. Kasi kung ganun na na-experience niya, then hindi na siya growing pains. Hindi na siya case ng growing pains. Although mas unti yung alam nating pain na na-experience ng mga bata, however, most of the research na kinakandak about year 1983 focuses in children. Actually, some practitioners believe na little pain lang yung nafe-feel ng mga bata kasi yung brain nila is immature pa, meaning hindi pa develop. Kung kaya, yung mga minor surgery like pagtutuli ay ginagawa sa mga bata at hindi binibigyan ng anesthesia. But with the help of the new researches, um, yung mga researchers kasi ngayon, they shows na there is no relationship sa edad ng bata at yung pain na experience nila. So, nagbago na rin unti-unti yung mga pananaw ng mga tao. So, pain in children's sensory and cognitive development. Kahit na yung mga issue about yung issue about mas sensitive ba yung adult kaysa sa mga children, in terms of feeling the pain is not resolved, one thing is clear, na nakakaramdam ang mga newborn babies ng pain. The fact na umiiyak sila kapag pinanganak sila, 'di ba? Kapag pinalo sila ng doktor, kapag hindi pa sila humihinga, hindi pa sila humihinga, kailangan silang paluin kasi, 'di ba? It's para makitang para kapag pinalo mo kasi sila, parang nag-a-activate yung body nila, parang ganyan. Tas iiyak sila. So, 'pag gano'n, obviously nakakaramdam sila ng pain, hindi ba? So, better excuse me, better evidence that babies perceive pain comes from studies with newborns as they underwent medical procedures, such as when the foot is pierced to draw a blood sample. So, itong mga reaction itong mga reaction na 'to mga babies pain, show really, pain expression na katulad ng mga nakikita natin sa mga matatanda. Then, itong mga pain na 'to, they show reaction like pag-squeeze ng eyes nila, pagkunot ng noong, and pag-open ng mga mouth nila. Kung saan itong mga expression na 'to is very comparable sa expression yan ng mga adults kapag nakaka-experience sila ng Another study found that newborns crying varied with the intensity of the noxious procedure. Highly noxious procedures elicit cries with certain characteristics, such as relatively high pitched peak tones that adults judge as indicating urgency. So, isa sa mga difficulty sa mga batang-bata, sa mga bata na I mean, isa sa mga mahirap kasi, mahirap sila mag-express ng ng pain nila. I mean, it's hard for them sa pag-express ng experience nila sa pain. Kasi nga, 'di ba, limited lang yung language nila. Madalas sa mga babies, no, nakikita lang yung sinasabi lang nila kapag na-experience sila ng pain, 'pag nag-ouch, 'pag narinig natin nag-ouch, yung ow, hurt, yung mga ganyan lang yung mga ano, yung mga nasasabi nila kapag nasasaktan sila. Hindi nila na-expound pa yung nararamdaman nila. That's why nakakatakot 'pag yung mga bata yung mga nagdi-discussion-ize kasi, kulang pa yung vocabulary nila. Kulang pa, hindi pa nila na-express nang mabuti yung sakit na experience nila and 'pag mag-e-express man sila, it's through crying lang, rubbing the affected area, pero hindi nila masabi na, itong like lalo na kapag internal yung pain, like hindi naman nila masabi na sa part ng, like sa heart, yun yung heart nila yung masakit, yung mga ganyan, 'di ba? Fun fact, by 13 years of age, children use about 26 words to describe their pain. Okay. Assessing pain in children. When patients have symptoms that includes pain, the physician usually needs to know its location, intensity, quality, duration, and temporal pattern. Itong mga information is very helpful para excuse me. Kasi nga sabi ko no, itong mga information na ito is very helpful kasi it helps them to accurately diagnose yung pain na na-experience. Although limited lang yung information na may bibili ng mga children, specifically ng mga bata. Kung kaya nga, no, kaya nag-develop ng mga researchers ng mga age-specific measures that use like self-report, behavioral, excuse me, self-report, behavioral, and physiological measures. So aside from what we have to take note that we have to take note also na interviewing children requires skills sa pagde-develop ng report with them. Pagtatanong ng mga questionnaires na kailangang maintindihan at syempre kailangan mo ding maintindihan yung mga ire-response nila sa'yo. So, tulad nga ng sabi ko sa inyo, ito yung mga ito yung mga na-develop na excuse me. Ito yung mga na-develop na rating skills na ng mga measures ng mga researchers. We have rating scales just to describe the intensity of their pain. Okay, unti na ako man. Wait. Excuse me. Wait lang. Ayan. Again, rating scales to describe the intensity of their pain. So, however, children about 5 years of age, yung assessment na ginagawa for them is made on the basis of pain behavior tulad ng vocalization and facial expression. So, another one is visual analog scales and verbal rating scales. It's used by older children if the choices are labeled in a way they can understand, such as face indicating degrees of distress. Last one is the pediatric pain questionnaire and the children's comprehensive pain questionnaire. So in this questionnaire, these instruments assess the pain itself and its psychosocial effects. So in here nga, no, makikita natin kung paano nag-react sa pain ang mga child and family. Pwedeng tumutulong ang mga matatanda sa mga bata sa pag-fill out ng mga questionnaires kapag sila ay nahihirapan and kapag hirap sila sa kasanayan ng wika. Okay. Behavioral and physiological assessment approaches. This provides valuable ways to measure children's pain, especially in early childhood. So the most obvious behavioral approach simply involves having the child or the parents report the child's pain behavior in pain diaries. Again, guys, na-discuss natin yung pain diaries kanina, di ba? Other behavioral assessments can use structured clinical session in which healthcare workers rate or record the occurrence of the pain behavior. So, according sa mga sources natin, no? Sa sources natin, child's pain experiences are affected by a variety of psychosocial factors, particularly sa environment kung saan nag-start yung mga sakit. However, unti lang ang ating mga kaalaman nga pagdating sa personality and the family characteristics ng mga bata na nagko-contribute sa intensity ng pain, ay intensity and the frequency of the pain. And that is something na kailangan pa natin actually na mas bigyan pa na ng pansin. Yeah. Kasi I think really guys, no, kailangan kunti pa talaga kasi nagtingin din ako ng mga researches about dito and unti lang yung about sa mga bata, mostly pang mga matatanda. Which is something na sa tingin ko mas kailangan pa natin ng more information or more details about dito sa mga bata kasi tulad yung sabi ko, ang hirap kasing, ang hirap, ang hirap nilang makipag-usap. I mean, ang hirap nilang i-describe yung discomfort na feel nila since ituturo lang nila yan or mag-ouch-ouch lang sila, mga ganyan. So, hopefully, may mga study pa na mga conduct about ang mga respondents mga bata or at least may mga tools pa or mga measurement pa na makagamit in the near future. Oh, so I think yeah, that's the last slide. So that concludes our presentation, no? Hopefully may mga natutunan kayo sa amin. And yeah, bye everyone and keep safe.